Susie, what's wrong, lady?
Oh man, it's just this constant cough and chest tightness. I keep spitting out this nasty green stuff.
Well, we better get you to a doctor, Lady Susie.
Hello, miss, what are your symptoms?
I have shortness of breath, constant cough with mucus, chest discomfort, and I have asthma.
Are you a smoker or are you exposed to a lot of air pollutants?
I am a smoker and I live in downtown Red Deer, which has poor air quality.
Because of Susie's environmental exposure to risk factors and symptoms, I am going to evaluate her as a possible chronic bronchitis patient. A genetic risk factor for chronic bronchitis is the alpha-1 antitrypsin deficiency. Antitrypsin is a protein inhibitor secreted by the liver which stops neutrophils from damaging lung tissue. The deficiency causes neutrophils to be recruited to the lungs, causing a breakdown of elastin fibers in alveolar walls, decreasing surface area for gas exchange and reducing expiratory flow rate, trapping CO2 in the lungs. Chronic bronchitis is a form of chronic obstructive pulmonary disease, which is a large group of lung diseases that can cause breathing problems. There is an excess production of mucus in the lower respiratory tract. The bronchioles become inflamed and fibrous, impairing lung ventilation and gas exchange. The purpose of respiration is the exchange of gases such as O2 and CO2, which help with the regulation of homeostasis. The buildup of carbon dioxide in our bodies is what causes us to breathe. This allows the balance of acid-base regulation, which is required for maintenance of our extracellular fluids because cells require O2 and creates CO2 waste. Diagnosis requires imaging tests such as X-ray or CT scan, as well as breathing tests such as spirometry and peak flow monitor. In order for bronchitis to be classified as chronic, the patient needs to experience symptoms for 3 months out of the year for 2 years. Normally, air enters the bronchi with no irritation, and the smooth muscle in the bronchioles determines the airflow needed. Notice that there are only few goblet cells and no inflammation, as well as an unobstructed airway. Undamaged mucosal tissue within the bronchioles will produce goblet cells as needed. Cilia will propel mucus and particles towards the throat, where it will hit the epiglottis. Here you see that there is minimum mucus, and the cilia on the cell membrane are performing their duty, moving mucus. The epiglottis will then open and allow the mucus to be swallowed as a normal function of respiratory protection.
Recurrent inflammation leads to structural changes.
That's right, it's called hyperplasia, which is the increased production of goblet cells and the hypersecretion of mucus.
The cilia are damaged and not functioning well with all of the excess mucus. That is what is causing my symptoms of spitting out mucus and difficulty breathing.
Here you see that there are more goblet cells as well as mucus obstructing the airway, along with inflammation making airflow difficult. Yes, the mucus clogs the airways, impairing the function of the cilia and decreasing the body's ability to remove excess mucus. The excess mucus pools, allowing bacteria to grow, which results in increased respiratory illness. Airway obstruction leads to arterial vasoconstriction in the lungs, resulting in reduction of blood flow and right-sided heart failure. Trapping CO2 in the lungs causes hypoventilation, which is shallow breathing caused by excess CO2, and hypoxemia, which is abnormal O2 in the blood, causing fluid retention and cyanosis around the lips, nail beds, and face. You will develop the appearance commonly referred to as blue bloater. Sorry, Annie. It is a medical term used to describe the stocky build of those with chronic bronchitis. It also refers to peripheral edema. Treatment is geared towards management of the disease, avoiding irritants along with medications to open airways and clear mucus, and inhaled meds such as steroids will be crucial to treatment of your disease.
Can I just get a lung transplant?
That is very rare, but measures such as lung reduction surgery and pulmonary rehab may be necessary if you do not make changes to your lifestyle. Hey Susie lady, what did the doc have to say?
I have chronic bronchitis, but as long as I quit smoking and take my meds, I will be okay.
So 100% then.
No, the damage done is not fully reversible, but I can work towards a healthier lifestyle and keep jamming.
Homeostasis is disrupted when the acid-base balance and gas exchange is altered. Dudes. The cell membrane is changed by an increased production of goblet cells. Protein deficiency of alpha-1 antitrypsin produced by the liver causes an increase of neutrophil recruitment to the lungs, resulting in increased large airway inflammation.